Alrighty, everybody, good morning. Thank you so much for joining me again for our latest Facebook Live. I'm going to give everybody a few minutes to just hop on as we're at just a little bit after 10:30 right now. But we are so excited to be joining you again, giving you an update on campus and, hopefully sharing some great information. So again, we're going to get started in about a minute. Just going to let a few more people sign on. Alrighty, so I think we can get started. Again, good morning. For those of you who may not remember, my name is Matthew Solomon. I am the Communications and Partnerships Manager here at Aviva. Thank you again so much for joining us on this beautiful, beautiful Friday. Happy Friday, everyone. So, as always, I like to start out with just some housekeeping things. If you have a question during the stream, I'd ask that you just write it in the comment section. That way I can answer them as quickly as possible and hopefully see exactly, hopefully get to everybody's questions. Second, when it comes to questions, I really ask that if you have a specific question about a resident, let's say your resident, please go ahead and either email myself. My email is going to be M as in Matthew, and then my last name, Solomon, SOLOMON, at avivaseniorlife.org. Or you can go ahead and contact our Director of Resident Services, Esther Bodfield. So this is really more of a forum just to kind of ask your questions about what's going on campus, what's going on with COVID-19, and things like that. So, as always, I like to start out by just saying, Aviva continues to be really proud that we are completely COVID-19 free. We continue to be COVID-19 free with residents and staff. We continue to not have anyone in consideration or under investigation that may have COVID-19. So once again, we are so thankful for that. And I really want to stress that is 100% a result of the policies and procedures we have put in place. I think we've been getting a lot of comments offline that our policies and procedures may seem a little bit more stringent than some other communities, that we are extending our policies and procedures past the timeline that other communities have. But I have to stress that the fact that we are COVID-19 free here in Sarasota is a very big deal, and that's directly linked to some of those policies. One of our newer policies that our Anshin and Benderson families received a letter about this morning that's really important to keep in mind is regarding medical transport. So if a resident of Anshin or Benderson has a medically necessary doctor's appointment or physician's appointment that's off campus, we are asking that the family and the resident work with Aviva to coordinate transportation. We're not going to have private transportation. You're not going to, kind of put mom and dad in a car and you're going to take them. We're asking that you coordinate it through Aviva so that we can provide transportation, or we can work with our medical transport company who, we know for a fact is going through the sanitation process and really keeping our residents safe. So that is actually that was in a letter that went out via email, and it's also going to be on our website later today. So, Jill asked that we go over how successful the Giving Challenge was. So thank you so much to everybody who participated in the Giving Challenge last week. It was last week. Days are just flying by, but it was such a treat to see how many people really came out to support Aviva. We did pass our goal So our original goal was to raise $10,000 for the emergency COVID-19 fund, and we surpassed that. We actually got closer to $15,000. So that has been so amazing. We have been so fortunate to see how much money we've been able to raise for the emergency COVID-19 fund. And all of that money, so people know where it's going to supplies like face masks and isolation gowns and things like that, if we were to ever need them. It's going to various activity supplies to make sure residents have fun things to do here on campus. We're also using it to help support our staff, really make sure that they continue to get the supplies and the resources, and even just making sure that their paychecks are not affected, which we are so fortunate to say that none of our staff have had to be furloughed, no staff had to be laid off. Our staff, we are supporting them as much as they're supporting our residents, so it's been really, really great to see that. And Jill, I appreciate that question. It's always fun to talk about something that was so successful and so exciting to see. So I would say this is the first year that Aviva has really gone full throttle on participating in the Giving Challenge, and that has been we're so excited to see that was successful. Jill, will you be handing out more masks to the residents? So as we mentioned a few weeks ago, we did hand out masks to our independent living residents, and ask them to follow the same guidelines that many medical professionals across the country are doing, which is to reuse paper masks at that point. They were KN95 masks. Since then, we have made masks available for purchase through the grocery store that we're running here on campus. These are cloth reusable masks. They are $3 a piece, and a lot of residents have chosen to go ahead and purchase those masks. They can continue to keep using their KN95 masks, mostly because they're not using them for such extended periods of time like so many medical and hospital professionals are, that we worry about the quality of the mask deteriorating. But many residents have chosen to go ahead and purchase the cloth masks. They're just more comfortable. They can be washed on a regular basis. And so we've had those masks available on the grocery store form for this week and last week. And I assume that we will keep it on there as long as we have enough supply to continue selling those cloth masks. So I really encourage any families to talk to their residents, make sure that they have gone ahead and purchased those cloth masks. They are great. I know there's been a lot of talk about the safety of cloth masks, and we have really spent a lot of time talking to the Department of Health as well as the Department of Elder Affairs when it comes to those cloth masks, and all of these experts agree that cloth masks are perfectly acceptable for anybody who is not in a clinical environment. So obviously our direct caregivers are going to be not using cloth masks. They're going to be using one-time surgical masks, and we have started that process last week actually. But cloth masks for staff like myself who are more in the administrative role, or residents, just kind of walking around campus or something like that, the cloth masks are absolutely an acceptable alternative. So, great questions, Jill. Thank you so much. So I think, just as we kind of wait for some additional questions, just some updates here on campus. I know that there has been a lot of talk over the past week and a half about reopening. This has become especially important with the governor's plan for reopening, his multi-phase plan. And so I think that there's a couple really important things to discuss when you're talking about that plan. First of all, we are still in phase 1 as a state for that reopen plan. And what's really important to keep in mind, and the governor actually repeated it several times during his press conference and in all of his handouts and online information about phase 1, it specifically mentions seniors or older citizens. And it specifically says that these seniors should still be maintaining a stay-at-home lifestyle under lockdown conditions. And that is because even as things reopen, we want to stress that this is the time where the virus may be at its most dangerous, as people once again kind of go out and interact with one another, even under social distancing guidelines, even under capacity guidelines. This is when the virus can be its most dangerous. So that is kind of a warning for all of our families. I do hope that you're taking care of yourselves, wearing masks when you go out, especially if you're in any kind of store, like a grocery store or a drugstore, a pharmacy, anything like that. Please, please, please continue to wear a mask. I know they can be uncomfortable, but as I said, a cloth mask is a great, great option. Continue to wash your hands, continue to observe social distancing. But when it comes to our residents at Aviva, so as I said, phase one specifically says seniors should not be looking to go out. They should still remain in kind of stay at home, safer at home lockdown conditions. It's actually not until phase 3 of the governor's state reopening plan that seniors are going to be encouraged, or not even encouraged, but the restrictions on seniors are going to be lifted. So it won't be until that phase 3 that we even consider some kind of visitation policy or some kind of transportation off campus. And as much as it pains us to really have to do that, as I said, we're very, very concerned about how the virus is going to spread during reopening. So we are going to be very, very cautious when it comes to how we are going to reopen our campus. And from what we've heard, unfortunately, phase 3 doesn't look like it's going to start for the governor's plan until sometime in June at the earliest. So that is when we are really going to start considering what our visitation policy may be. And I want to stress that visitation policy is still going to be very limited. You're most likely going to have to, you'll still have to be screened, you'll still have to wear a mask. We will only allow one visitor in at a time per resident. There may be a cap on how many visitors to the building at a given time. These are all some ideas that we have talked about already, that we're working on figuring out. And when it comes to reopening things here on campus, we are going to be starting next week to talk about some options to reopen some of our recreational activities. Things like the pool and the fitness center, but again, those will probably be limited to 1 or 2 residents at a time. There will not be any furniture, for them to sit and congregate at. All of our indoor spaces, like our library and our card room, will remain closed. Again, not only is it a social distancing concern, but, those indoor spaces can be really, for lack of a better term, breeding grounds for the virus. Not that we have any reason to believe that the virus is here on campus, but again, we just feel that it's better to be prudent and safe. So, that is kind of how it's going to go here with our reopening. I can tell you, and I've spoken to several families already about this, but I can tell you that our dining locations will probably be the absolute last thing that we open here on campus. That is just because we feel like that is such, so that is just because there is such a chance for, cross-contamination. You have a lot of staff members in the dining room, you have a lot of residents in the dining room. How do you properly space them out? How do you properly seat everyone? So that is going to be the last possible thing that we are going to open, and that is something that we are working on kind of coordinating with our food service team so that we have an idea that when we do feel it's prudent to start opening the dining facilities, we can do so quickly and efficiently. Greg, are staff going to remain in stay-at-home except going to work mode even if the governor moves forward and allows them to go out, such as to eat? That's a great question. We have been doing several different forms of education with our staff on, the importance of themselves observing social distancing, protecting themselves when they are off campus. And I can tell you, those of us in the healthcare profession are much more suspicious when it comes to the reopen plan than some other, industries may be. So we are going to be sending out various communication to our staff to remind them that even if they do choose to go out to eat, we highly, highly discourage it. Obviously, we can't stop them from doing it, but we highly discourage it. And if they do choose to go out, we are expecting them to wear a mask, adhere to social distancing guidelines. They will still need to be screened every time they enter the building. That is not going to stop. I can tell you that those screenings are probably going to continue well through the summer into the fall. And just making sure that our staff are getting the best education they can, so that if they do make that personal choice to engage in some of these reopen businesses, they are doing so in a way that is smart, that is safe, and that is safe for our residents. And we have been communicating that both in English and Spanish, as some of our staff, English may be a second language, and we really want to make sure that that message is super, super clear. So, Greg, I can tell you that while it's not my place to instruct our families on how to act and how to behave, I would really highly, highly recommend that everybody continues to do the stay-at-home method, that continues to do lockdown, continues to only go out of the house for essential responsibilities like grocery shopping or medical appointments. That would be my recommendation. It's the recommendation that most healthcare professionals are making. If you do choose to, go against that recommendation, that's completely up to you. But I do sincerely ask that you're wearing a mask, that you're washing your hands. Gloves are not the be-all, end-all. I would honestly say that instead of using gloves, wash your hands, sanitize your hands. That is actually probably better for you than the gloves, because remember, as soon as you touch something with a glove, that glove now has those germs on it. So if you touch something like your car or your shirt or something like that, you're passing those germs along. So, really just the big three things: wear your mask, wash your hands, social distance. That is what we are really encouraging. And at the moment, we haven't felt that even with the reopen strategy, those three things are being maintained in the way that they should be. So I can tell you that most of our staff is being really good about what they're doing, how they're doing it, checking in with us about what's appropriate, what's not appropriate. So I really think it's important. We've been really, really trying to work with some of our younger staff, especially like the high school students that we're so grateful for, who continue to work as servers for us. Really, really trying to educate them about the importance of social distancing and about being, appropriate when going out. So that they've been really receptive to it. We've seen them, kind of take charge here on campus of, wearing their masks, keeping each other accountable for their actions. So it's really been a great team effort. So, do you see some people are joining us? So again, I want to repeat, and I'm going to keep repeating this, throughout the broadcast, that Aviva remains COVID-19 free. That is, we have no cases of COVID in both residents or staff, and we also currently do not have anybody under investigation for COVID-19. That means nobody's showing symptoms. We don't have anybody who may be coming into contact with somebody with COVID-19. So we are still completely COVID-19 free, which is something that we are so, so proud of and feel very, very blessed about as well. So, please feel free to continue asking questions. These have all been great questions so far this morning. So in terms of other kind of things that have been in the news that I think is important to discuss is testing. We've gotten a few questions regarding testing residents and staff here on campus. What's going on with testing? How is that being done? The governor announced his mobile testing unit to go to long-term care facilities. We've had a couple families ask, when is that going to be here on campus? How is that going to happen? So I think it's really important to know that even with the increased testing centers going on, I know that the folks over at UTC who are working the testing center are exceptional. Their quality is exceptional. They are doing such a great job. Even with all of those new things, testing supplies still remain very, very scarce and very hard to get. And with so many communities here in the state of Florida, senior living communities, having such large hotspots of cases, meaning, there are communities that we, know through colleagues and through professional organizations that are looking at 30, 50, 60% of their residents testing positive for COVID-19. So the testing supplies that are kind of earmarked for senior living, that's where they're going first and foremost. They're going to those hotspot communities where they need to get a better idea of the situation, of what's going on with the residents and what's going on with the staff. So that's where we're seeing that push for those testing supplies to go. That's where you're going to see the mobile testing units go first. That's also, there have been a lot of stories about the National Guard being brought in and doing some testing on campuses. That's where you're going to see those supplies going first and foremost. Then you're going to see them, imagine it's almost like a tier system. So that's tier number 1. Tier number 2 is going to be those facilities that may have had 1 or 2, definitely under a dozen cases of COVID-19 and have retested on their own and have determined that those COVID-19 cases are no longer active. You're going to see the state come in and test those communities. That's to really look for, is there continuing traces of the virus on campus? How can we trace where the virus came from? Things like that. So that's that tier 2 level. Then where Aviva is, we are at tier 3, which is we are a senior living community caring for, caring for an at-risk population, but has no traces of COVID-19. That's when you're going to see that final tier of really just making sure that all of our seniors are being cared for, all of our seniors are being tested. My guess is that that is going to happen before the phase 3 of Governor DeSantis's plan takes into effect. So my guess is, and from what we have heard from our contacts in Tallahassee and our contacts across the state, is that for phase 3 of the reopen plan to happen, the governor wants to see 80 to 90% of senior living residents across the state being tested for COVID-19. So that is what we're hearing. Again, we're kind of, it's like one great big game of telephone when it comes to kind of the statewide response to the virus. So we're, keeping an eye on everything. We're keeping an eye on testing, especially as more testing centers open up and more testing centers are offering testing without symptoms. So we're definitely keeping an eye on it. But at the moment, I really want to stress that you're not going to see the National Guard here on campus testing people. You're not going to see the state's mobile health department come and test people, because we are considered a tier 3 community, meaning that we have no cases of COVID-19. We have no reason to believe that there's a COVID-19 case here on campus, and therefore the resources need to go to those communities that are at much higher risk. And, especially with thinking about our friends in Pinellas County, in Broward County, and in, Miami-Dade area, it's such a priority that we get those residents the tests that they need and the supplies that they need. So, I think the entire healthcare community is really coming together, especially in senior living, and that's where the testing is really going. So I hope that kind of provides a little bit of update on testing. That doesn't mean that, God forbid, we do feel that we have a need to test, that we can't immediately get testing done, and we have those, have those two ready to go. So thank you everybody for the great comments. It's really motivating. We really appreciate all the generosity and the grace and the kindness that you've all shown us and our staff. Please know we truly understand what a huge emotional burden this whole situation is taking on all of you. to be separated from your loved ones. So many of you have been, staying at home and lockdown, things like that. We truly understand. The residents are feeling it too. They feel, that they're separated from you all. And it's definitely something that is upsetting and a struggle. But please know that we are doing it. Please know that we're doing it to keep everybody safe. We are really doing this not to be, mean, not to try and separate people, not to keep people off campus. We're doing it to try to keep everyone safe. And, as I keep telling people, when reporters call me or when families call me, the old saying, the proof is in the pudding. The fact that we have been able to remain COVID-19 free for so long, is a huge testament to what we're doing on campus is working. And to rush into reopening, to rush into visitation, that poses not only a risk of the virus coming onto campus, but those sudden changes in reopening can cause the virus to come onto campus in a way that is absolutely extreme. So we are really just thinking about our residents and our staff and our families when it comes to our policy. So I do hope that people understand that. As difficult as it is to say that, and as difficult as I know this whole process is, I really hope people can understand and appreciate that, our goal at the end of the day is just to keep our residents safe. So, Robin is saying, please keep up with the transparent communication. Robin, I can tell you that both myself and our entire senior management group are absolutely 100% committed to transparent communication. Absolutely. As I have said in the past, as we have said in our various letters, in our various communications, we believe in transparent communication 100% of the time. So, God forbid we had a case, a COVID-19 case, or somebody under consideration or under investigation for COVID-19, we would, within the minute of understanding what's going on, we would release that via email, we would release that via Facebook, we would release that via our website. Letters would go out to all of the residents, as well as we would put it on our in-house TV network. And if it is in a specific part of campus, let's say that we, God forbid, identify a COVID-19 case here at Kopernik, here in Independent Living, our entire team is dedicated to calling each and every single resident family, discussing what's going on, discussing the situation, and discuss what we're doing next. So I cannot say enough that we are committed to providing you all 100% transparency, 100% honesty, and we're going to continue doing so forever. I mean, it's really our policy across the board, but as long as COVID-19 is a threat, we are going to keep you posted, keep you updated, even if I have to, come onto these Facebook Lives and just say, everything's fine, everything's great, and that's it, and we don't have any questions, I will continue to do so. So I really hope that provides a little bit of some additional comfort to know that we are really thinking about how this affects all of you, and we're committed to doing everything we can to make that easier. So as I kind of, it's about 11 o'clock. We still have some more time if people have some additional questions. I do want to, just mention some great things that are going on campus. Today, our Anshin and Benderson residents are getting a little surprise kind of Mother's Day parade going outside. It's a car parade, I promise. We're observing social distancing, so that's going to be great fun. On Monday, we have kids from the PJ Library Group are going to do a car parade for our Kopernik residents. They're bringing signs and they're gonna, cheer and things like that. We're expecting it to be a lot of fun. We're going to be working with residents who may not have a direct view of the road from their lanai so that they can see the parade as well. As always we do for Mother's Day, every resident, every mom or grandmom here at Aviva is going to get a special treat, whether it be, a rose with dinner or a candy bar or just a special treat to say, we appreciate them and we love them just as much as you all love them as well. So, definitely some fun things going on campus, really trying to keep that energy up. Anything for Kopernik Moms on Sunday. We're doing a special Sunday evening meal. As always, we do our special Mother's Day meal. Even if people are eating it inside their apartments, they're still going to get that, classic Sunday evening meal for moms. And I believe our Director of Life Enrichment, Maria Leonardo, has some special things planned for Sunday in terms of live entertainment, and things like that. So don't worry, we're going to make sure that this Mother's Day is just as joyous and just as filled with love as any other Mother's Day at Aviva would be. Lori, I see that you have 2 questions. Are you still keeping strict procedures at AL and Benderson? And are you still not accepting new people into Anshin or Benderson? So, to answer your first question, 100%. Anshin and Benderson, no policy procedures have changed. It's important to keep in mind that because those 2 organizations receive both state and federal funding, we are taking special direction from our state and federal government agencies. So, Anshin and Benderson, we take our instructions from the state government agencies or our federal government agencies, and then we enact our own policies based on those recommendations. So, AL and assisted living, memory care, and our skilled nursing facility are operating under the same policies that they have done so since the very beginning. They're still locked down. We are still not allowing visitors. Our staff is still being tested. We still have isolation units for anybody who may come back to campus and things like that. So no policies have changed at Anshin and Benderson. Are you still not accepting new people into Anshin and Benderson? The answer is yes. We are still not accepting new admissions. The only admissions that we are currently accepting are Aviva residents who may need to be moved to a higher level of care due to safety, due to their own safety and their own health. And in that case, they are being quarantined for 14 days in an isolation unit, whether they're returning from the hospital or returning from an acute care situation. So that is really the only kind of movement, I would say, that's going on at either Anshin or Benderson. Jill, you saw the special ice cream truck. That was a lot of great fun. Special shout out to Ellen Frank, our life enrichment coordinator at Anshin and Benderson, for that special ice cream truck. And to answer your question, Jill, yes, we are planning on bringing Ellen's famous ice cream truck to Kopernik. I believe that we are working on dates and times and things like that for it. So that at least we can do, maybe one wing at a certain time and one wing at another time, to make sure everybody can really appreciate it. Mitch, you're looking for contact information for Maria. So again, Maria is our Director of Life Enrichment. So her email address is going to be M as in Maria, then her last name, Leonardo, Leonardo, at avivaseniorlife.org, or feel free to call the main number and ask to speak to Maria. Lynn, you're asking about that we're streaming special movies and special shows on your in-house channel. Do we have a Netflix subscription? We do have access to a Netflix subscription, not to worry. It's advantage of having, over 150 plus staff members. We can absolutely get a Netflix subscription. But we have actually been really amazed and pleased. And if somebody's looking for something to do or some entertainment, I highly recommend it. We have been finding some great classic movies and classic performances via YouTube, which is where we're getting a lot of our content from. So I think over the weekend we have a few special concerts planned. Of Frank Sinatra and Louis Armstrong, and really some amazing things that YouTube is providing. So we're really excited that we continue to provide that. We definitely have access to Netflix if we run out of content. But again, Maria is wonderful about communicating with residents. What kind of content are they looking to see on the in-house channel? What works, what doesn't work? So she is really providing some great feedback. She's getting some great feedback on what our content should look like. So we'll continue to use that probably even after we lift the lockdown and residents are free to go to activities and things like that. We found it to be really accessible, and a lot of our residents are really enjoying it. And it's great fun for us as staff, as you walk through the building to hear the music, going on the TVs and things like that. Definitely brings a nice livelihood to campus. So, but if you think of any specific things that you think our residents would enjoy, again, feel free to reach out to Maria. We're definitely looking for additional ways to keep residents happy and engaged. So, again, that's Maria Leonardo, Director of Life Enrichment. So, a little bit after 11, I'm going to ask, does anybody have any questions, anything that they would like me to go over in terms of topics that maybe I haven't touched on yet? Jill is asking about our hairdresser and our salon. So, when it comes to our assisted living and skilled nursing, I know that nurses have been working to wash the hair of our residents who need it, who maybe have some trouble washing it themselves. Here at IL, here at Kopernik, we are actually working with our salon to find some kind of reopen strategy for the near future. We know that that is a big want. It's something that's really, really important to our residents, not just from a vanity perspective, but from a really hygiene perspective. So we are talking to the salon. We actually spoke with them this week. We're going to have a brainstorming meeting with them next week to see if we can offer some kind of salon services, whether it be in the apartments or in our salon itself. So please know that that is something that we are definitely aware of, and we're definitely pursuing. We always have a little bit of concern of somebody going into the residents' apartments that's not directly our staff. Remember that both of our salons are a third-party company. So we're really trying to work with them so that they understand our policies and our expectations, and that they can meet those expectations. So I'm confident that within the next week or two we will find a solution to that, and we'll be able to start providing that not only here at Kopernik, but maybe even some kind of alternate reopen strategy for the salon at Anshin and Benderson. So I don't know about the nail salon part. I can't promise that our ladies are going to be able to get their nails done immediately, but definitely their hair done in some fashion as quickly as we possibly can, but in a safe way. So thank you, everyone. I appreciate the great feedback. If there's anything that you feel like these Facebook Live sessions are missing, or things that we can improve with these Facebook Live messages, feel free to shoot me an email or send a message through Facebook. These sessions are really for all of you, and I want to make sure that they are helpful and worth your time and worth the making sure that you feel better, at least get some kind of sense of well-being after these sessions, to the best of my ability. So, with that, I'm going to say again, last call for questions or any topics that I may have missed. Though I do love all the positive feedback, I don't want you all to have to sit and stare at my face for too long. As I always say with these sessions, you are always more than welcome to reach out to me or to any of our staff members with specific questions, with concerns, with maybe you need further clarification about something. We are really here to help. As I said, I was going to repeat it multiple times, so I'll repeat it now at the end. Aviva remains COVID-19 free for both residents and staff, and none of our residents and staff are under investigation for COVID-19. So, we are so proud of that. We are going to continue doing what we feel is best to keep that going. And that's our promise to all of you, is that we are going to care for our residents and protect them and do whatever we feel we need to do to make sure that our campus remains COVID-19 free. So hopefully that is a great message that we can end on. To all the moms out there, including my own, who I believe is watching this live stream, I want to wish you all a very, very happy, safe, and joyous Mother's Day. I know it's going to be an unusual Mother's Day, but I hope that we all find ways to connect, whether that's virtually or through social distancing or whatever the case is, to celebrate the moms. I know that we're going to do so on campus. So again, happy Mother's Day to all the great moms. And have a great weekend. Enjoy the weather, and we hope to speak to you soon. All right, everybody, happy Friday and happy Mother's Day.